good book says, "For lack of knowledge, my people perish." Yes, truly, for lack of up-to-date health information, new health trends, infographics and perspectives, yes, your health and well-being will perish. That's why you need to join seasoned, well-trained and licensed health professionals as they set to have
Orange
round-table discussions
107.9
that matter to you and I. The Orange Health Lounge is your best bet, with stimulating conversations and eye-opening revelations. Join Dr. Bafojima every Saturday morning at 8 a.m. as he serves you discussions and conversations that are centered on your health and well-being. Health is expensive, but you can afford it with information on the Orange Health Lounge. Orange Health Lounge. Live healthy in color.
He's already seated in the house, and today we're going to have a very wholesome conversation on what it means, or what it means to be told that you have a medical diagnosis of a peptic ulcer. My guest is Dr. John EMMANUEL OPPONG MENSAH. He's a pharmacy resident in the internal medicine department at Komfanoche Teaching Hospital, and later on in the show, we'll also talk about something else that he's involved in. John, welcome.
Thank you, my boss.
It's good to see you here, back in the studio.
Good to see you too.
It's very good when pharmacists lead conversations when it comes to public health. And we're always pleased to have someone like you here in the studio. So thank you very much.
Thank you very much, sir.
All right. So often, and for those who want to join our conversation, our show is live and interactive on Orange 107.9 on YouTube, and you can also join the conversation if you hear anything that piques your interest via WhatsApp on 05939329993. So if you go online on YouTube right now, we're live and you can watch us right there. So John, like I was saying, a lot of times when people have any form of medical issue, they are very much likely to just walk into a pharmacy.
Yeah.
Like I said, I've trained myself to stop saying pharmacy shop, into a pharmacy, and explain their symptoms away and get something. I want you to start our conversation from there.
Okay.
Should people be walking into pharmacies and just spelling out what they're feeling and then get medication?
Yes, so thank you for the question. For pharmacists, right now, the community pharmacy practice is changing from hitherto just drug-centered. Right now, even a community space, we are being trained into medication therapy management. We are being trained into certain professional services towards primary health care services. Yes, so usually I advise that when people enter into a community pharmacy, they should ask for a pharmacist, because if you speak to a professional pharmacist concerning your plight, concerning your symptoms, and it's beyond the community pharmacy space, he would definitely have to refer you to a hospital. Okay. So now the pharmacy has now become the first point of call where referrals can even be made. Recently, the Pharmacy Council is piloting through the National Electronic Platform space. We are piloting something where people come and check their BPs, and then we record the BPs and document it on a particular platform where they can be referred.
Okay.
Yes, so where they can be referred to the various hospitals. Okay. So let's say the person came, the BP is very, very high. Then you fill it in the software. Then the referral will be made. So the patient's details are copied. The contacts are also there. Then definitely they will get a referral for the person. So they will definitely contact the patient. They'll tell the patient to visit this hospital so and so close to him or her. So as I said, the pharmacy is also becoming like a referral site, because when we look in our communities, we see pharmacies around, and it's mostly more accessible to people. And I think patients also feel more comfortable going to community pharmacies.
Pharmacies, yeah.
Yes.
Yeah, yeah.
So if they go to the community pharmacist and then they ask to speak to the pharmacist, and the pharmacist can do something about it. If it's a disease of common occurrence, and he can at least initiate something, and if he can even refer afterwards, it's well appreciated. Yes.
So then that's good advice for the general public. I think it's good to note that our colleagues in the pharmacy profession have come out of this "I'm always behind the counter" to very, very keen patient interaction. I think it makes our works even easier as clinicians as well. So let's delve into this thorny topic of a peptic ulcer, or what people generally refer to as an ulcer. What is it exactly?
Yes. So usually people say ulcer, but if you say the word ulcer, we have different types of ulcer. We have Borrelia ulcer. Yes. So ulcer basically means a break in the skin integrity. Yeah, so a break in the skin integrity. So if you have an ulcer on your skin, it means that there's a break in your skin integrity. But when we talk about peptic ulcer, we are talking about an ulcer that is in your GIT. When I say GIT, from your stomach to your intestines.
Okay.
So peptic ulcer, we can have two types. You can have the gastric ulcer.
Okay.
And when we say gastric ulcer, we are talking about your stomach. So if you have a break in the lining of your stomach, resulting in an injury, then it's gastric ulcer. Then there's also duodenal ulcer. So right after, if you look at the anatomy, right after the stomach, then we have the duodenum. So the duodenum is also part of your intestine, the small intestines, and the ulcer can also be situated in your duodenum.
Okay.
So usually for patients, we see patients coming with varying symptoms. Some patients will come in with, they will tell you that, when they eat, they feel the pain. But after they are done eating, the pain goes away. So this type of ulcer is usually stemmed from gastric ulcer, because with the gastric ulcer, the ulcer is in your stomach. So as soon as food falls in your stomach, it exacerbates the pain. It makes the pain worse. Unlike duodenal ulcer, with duodenal ulcer is the contrary. Because the ulcer is situated in your duodenum, the pain usually comes when you are hungry. Because when you are hungry, at that point, that's when the acid from your stomach will even get to the extent of reaching into your duodenum, and then it exacerbates the pain. But as soon as you are done eating, and then the acid is engaged in your stomach, then the pain reduces. So with duodenal ulcer, the pain reduces when the person eats. So patients should know the various types of ulcers. Yes. And then they should also know that usually there are two types of ulcers based on what causes it. So we have NSAID-induced ulcer, and we have the H. pylori induced ulcer.
Okay, so let's break it down. So when we say NSAID-induced ulcer, like what is that? What's that NSAID actually?
So an NSAID usually is an acronym. It means non-steroidal anti-inflammatory drugs. And these drugs, most of of us are familiar with it. Like I give examples like brufen. Brufen is an NSAID.
Okay. So people who take a lot of these quote unquote painkillers. Over-the-counter
painkillers.
Okay. All right.
So these are over-the-counter painkillers, apart from paracetamol. Paracetamol is not an NSAID, but most of the painkillers which are over-the-counter and not prescription-based are NSAIDs. So we have the likes of brufen, and piroxicam. We have diclofenac. Yes, and I remember there was one time a patient was admitted, and then the patient had this bleeding ulcer. Upon investigation, we realized that this patient was a footballer, and then he was abusing piroxicam, the one that they call red. Topair red.
Topair red, no.
Yes. So he takes that drug. The ideal dose is once daily, like just a single capsule once a day. And he was taking 8 capsules in a day. He just took it for just 1 week, and it caused him to get ulcer to the extent of it even bleeding. And then he had to be admitted at the emergency, and it was an emergency situation. So please, to the public, I would say that let us not abuse over-the-counter painkillers. Okay. Let's always speak to a professional about it. If you are in a type of pain, speak to a professional about even how long you should take it. Don't say that, oh, I'm taking it for as long as the pain will be there. Because if you should take NSAIDs for a protracted period of time, a long period of time, it will cause you to get ulcer.
I think that's generally good medical advice, because I think quite a number of people are under the impression that some of these drugs that you mentioned, the paroxetine, the diclofenac, the ibuprofen, are not, I don't say harmful, but do not cause any serious problems. But from what you're saying, the unregulated use of these drugs without prescription, without professional advice, can lead to an ulcer.
Yes.
If you're just tuning in, this is 107.9 Orange FM, and we're on the Orange Health Lounge this morning. And this morning we're talking about ulcers, the type that keep you up at night. And sometimes they make things really difficult for you when you have them. And Doc is breaking down the NSAID induced before he goes to the H. pylori causing one. So the NSAID induced usually is caused by us. And it's
self-inflicted.
I see. But some also say that they get ulcers from the fact that they don't eat.
Yes.
Is that also a possibility? That some people starve for prolonged periods and they say because of that they have an ulcer?
Yes, so some people starve for prolonged periods, and if they have an increased risk of getting an ulcer, it can aggravate it. So with the ulcers, we have aggravating factors. So things that if you do, it can increase your risk of getting an ulcer. Yeah, so assuming that you are already on NSAIDs, and then you're not even eating. When you're not eating, you're also putting yourself into stress. And then the point that you're not eating, you're also passing by, let's say, assuming you are passing by people who are even eating. You know that when it comes to even acid release, we have different phases of acid release. We have the cephalic phase, the gastric phase, and with the cephalic phase, just the smell of food can cause you to have acid to be released.
Oh, okay. So it doesn't even need to be food that you are eating.
It doesn't even need to be food that you are eating.
The fact that you have gone past some joint and they're cooking their food.
The fact that you smelled it and then you've even seen it. So your brain processes it. And it causes you to release the acid. So prolonged acid release as against your protective factors. So naturally, God has put in place some protective factors in the stomach to prevent the effect of the acid. And if you should know, this acid is very corrosive. Acid is for corrosive. And assuming when you put a metal in acid, it can even bend, it can even melt the metal. But how come it's not melting the stomach? It's because of the protective factors.
Okay.
So the protective factors, the intestinal line, the stomach lining is a protective factor. There's also some kind of bicarbonate in your stomach
lining,
and the mucus. They are all protective factors.
Okay.
But as soon as you put yourself in a situation where the aggravating factors become more than the protective factors, then the balance
is off.
So you're not eating for a long time. And you're also passing by places where there's food and then you're cooking. If you're not careful, you can also get yourself in the situation. That's why if most of the time we've realized, let's say days that we've not eaten maybe for a long time and then we are exposed to so much stress, you have bloated tummy, and you go and buy these antacids. Yes, it happens to even me. It happens to me. And the point is that where is the gas coming from? why did your stomach even get bloated in the first place? It's because you produce acid. Yes. So if you look, well, let's go into some small chemistry. If you produce acid, the bicarbonate is also what? A base, right? So there's something called the acid-base reaction.
Okay.
So when acid and a base react, it produces what? A salt, it produces water, and it produces gas. So this kind of acid-base reaction results in the production of water and then carbon dioxide. So the carbon dioxide is what causes your stomach to bloat. So it's like you'll be having gas in your stomach, which you don't even know where the gas came from. So it tells us that whether we've eaten or not, if we are exposed to a situation that will cause us to produce acid, it will still produce the acid, and then the acid can eventually erode the surface of the stomach lining.
Okay. So
yes.
So it's not uncommon for people to say that their ulcer is triggered as a result of the fact that they've been starving themselves for prolonged periods.
Yes,
of time.
it's not uncommon at all.
Okay.
It's not uncommon at all. It's just that it increases their risk, but
Their
it's not.
risk.
We can't classify that as a cause.
As a cause, it just increases your risk.
Yes.
Of having an ulcer.
Yes. And there's also another thing that people should also understand and appreciate, that there's a difference between gastritis and an ulcer. The fact
gastritis.
that, yes.
Okay.
So gastritis is a minimal form where, because you've exposed yourself with some of these aggravating factors, your body undergoes some form of inflammation. So the inflammation happens in your stomach or maybe in your duodenum. That inflammation doesn't cause a break in the skin integrity, but at least it triggers your body to react.
Okay.
And that reaction can also cause some sort of pain.
Yeah.
And it could be transient. It could also be prolonged. It depends. So in that situation where people have gastritis, they will also have some minimal form of pain, and it doesn't mean you have ulcer. You have to go to a hospital to be diagnosed for ulcer, because if you have not been diagnosed, you can't say that your symptoms is
even
ulcer.
though they are similar to
even though it's similar to
someone with an ulcer
yes,
will
or
feel,
present with. Yes,
it may be that yours is probably just gastritis.
It's just gastritis.
Then quite a lot of people are misdiagnosing themselves, isn't it?
Yes, quite a number of people are misdiagnosing themselves, and some sort of people too also thinking that they have ulcer. Meanwhile, it's not ulcer, but it's also GERD. GERD is also gastroesophageal reflux disease, where you produce so much acid, and then the acid comes, it bounces into your esophagus. So they'll be having symptoms of heartburns, epigastric pain. So they have the pain at above their stomach, a little bit above their stomach, and they'll tell you that, oh, I've been having this pain at the a little bit in front of my stomach, and then they have this back pain, and then they'll tell you that they have ulcer.
Well,
but
it's because I think people use the term ulcer very loosely.
Yes.
Without knowing that there are different types of medical conditions that can make you feel this pain.
Yes.
Unfortunately, at the same spot that an ulcer pain is likely to be.
Exactly.
So if you're just tuning in, it might just be that you have, because it's easy to say I have an ulcer, and probably a bit more difficult to say you have GERD or gastritis. You may have misunderstood what is happening to you, and like Doc rightly said, you need a medical diagnosis, which happens in the hospital, so that like the right kind of medication
can be given.
Are there any, besides, you mentioned one, the risk factors, besides, let's say, people who intentionally or unintentionally starve themselves, or let's say fast, who are at risk? Because sometimes for me it happens when I unconsciously skip meals, like I'm in a hurry so I don't eat breakfast, and then sometimes around 11 thereabout I start having this very terrible discomfort, and I have to stop everything and go and find something to eat. But besides that risk of starving yourself, are there any other risk factors to, have an ulcer?
Yes. So there are several risk factors that we need to know. One of the main risk factors that is very common is stress.
Stress.
Yes. All forms of physical stress,
Okay.
Psychological stress, emotional stress, they all result in it. So someone could even go into a surgical stress, just for the fact that he's been through a surgery, he can get an ulcer. Yes, so stress can aggravate, it's one of the aggravating factors. And it's so because when you are exposed to some amount of stress, your body naturally produces a hormone called cortisol.
Yeah.
Cortisol is supposed to help you be able to survive the stress, but it has this inimical effect on the stomach, where it causes you to lose some of the protective factors. So cortisol can cause you to lose the bicarbonate protection of your stomach. And eventually, because there's something called prostaglandins. Yes, and the cortisol can reduce the prostaglandins. And these prostaglandins is what helps you to produce the mucus and the bicarbonate. Yeah, so when you lose that protection, it actually exposes you to the acidity. And then there are some foods that also contain, like, they contain acid. For instance, foods like tomatoes, citrus, so orange, lemon, pineapple, they contain acids already.
Okay.
Which can also increase the acidity of your stomach.
Oh, okay.
Yes. Okay. And also, there are some foods that can also cause you to produce excess acid.
Okay.
For instance, foods like caffeinated drinks, carbonated drinks.
Okay.
So when you take in such things, it can help, it makes you produce a lot of acid.
Oh, okay.
Spicy foods also causes you to produce a lot of acids.
Spicy foods.
Yes. So people who take in a lot of spicy foods, it's not that the spicy foods themselves will cause the irritation, but it causes you to produce, it causes hyperacidity.
Okay, so that's why usually there's a misunderstanding that people say, oh, when I eat spicy food, then it makes my ulcer worse.
Yes. Okay. So it causes hyperacidity, and there could be some ulcer lurking in there that has been very silent. Then it goes to what? Trigger it. Exactly. So that's the issues around it. And then apart from that, too, there have other risk factors. Smoking.
Smoking, okay.
Smoking can also cause it. Then alcohol. Alcohol intake. So the question is, how much of alcohol is recommended?
It must always be in moderation, and you
must be in moderation.
And you must stick to your limits. Yes. Wow. So spicy food can trigger increased acid production.
Yes.
Which may go on to aggravate probably a previously very silent ulcer lying somewhere and not bothering you.
Yes.
I see. It's interesting, and you can join the conversation on WhatsApp on 0593932 0593932 That's the WhatsApp line. You can send the text or you can send the voice note, and we will definitely play it or read it out on your behalf. 0593932 Besides the symptoms of the pain that you usually feel, just here in the middle of your chest, and sometimes the back pain, are there any other symptoms to ulcers?
Yes. So some people could have vomiting.
Okay.
Yes. So it can trigger them to vomit. Some too might have diarrhea. So with the hyperacidity, the ulcer, then it triggers some form of GI motility to be increased. So once the GI motility increases, then they have diarrhea. Some too will have the back pain as well. So everybody's symptom is quite different. Yes.
Okay. So it's not cast in stone that you're definitely going to have this form of manifestation, but
yes,
everybody's own is different.
Everybody's own is different, but the general one is the pain in the stomach or in the duodenum. So that pain is constant.
Yeah.
Some could have the pain at night. Some could have it during the day. Some could have it transiently. So it's once you're having any of these symptoms, please go and be diagnosed.
Okay.
Yes, you have to meet a professional, a medical doctor for diagnosis.
So it's important that you see sometimes it's important that if you have a medical condition, you also keep in mind what the symptoms are, how you're feeling, so that when you come or even when you go to a community pharmacy and you're explaining yourself, you are very specific, because it's not always about the pain. Some people have nausea, some have vomiting, some have intractable headaches that come with the abdominal pain. Some just even lose appetite, or they don't even want to eat, and the fact that they are not eating is even making it worse.
Yeah.
So you need to know what you're doing. Good morning to you, MENSAH. MENSAH is saying that when it comes to the NSAIDs, a lot of women rely on these medications to battle dysmenorrhea.
Yes.
And she wants to know if there's a correlation between someone like her who says she takes a lot of painkillers to battle dysmenorrhea, and she's wondering now if she isn't at risk of an ulcer, or if she hasn't already developed an ulcer.
Yes, so the NSAIDs is about the prolonged use. So with the dysmenorrhea, usually most women will have their menses spanning from 3 to 7 days. Very few people might have it being prolonged, but usually because it's just maybe it could be once in a month and it's not like a regular intake, that might not really increase your risk of getting the ulcer. But the situation is, if you have dysmenorrhea because you have irregular menses and your menses is for long, and then for example can have bleeding for like 2 weeks, and you're also having dysmenorrhea symptoms. And then the issue is, even the NSAIDs can also even increase your risk of bleeding. So in that situation, it becomes a topsy-turvy situation, because what you are taking will help your pain. It can also increase your risk of bleeding. Yes. So usually we advise that when people have dysmenorrhea, they take the mefenamic acid. That one has been shown to help reduce the uterine contraction, and then it causes uterine relaxation, as well as also trying to control the bleed. But if you resort to nominal NSAIDs like diclo, brufen, and piroxicam, ketorolac, those ones can actually increase your risk of bleeding. Yes. But as MENSAH has mentioned this one, it has brought my mind to this. That is actually going on. Nowadays, a lot of people abuse steroids.
Okay.
Steroids is also another thing that can cause ulcers. You see, as I was talking, I mentioned cortisol.
Yeah.
For stress. That is a natural steroid. But the steroids we are also taking is also, those ones are also manufactured steroids. They've been put in a form of drugs, and people take it for different reasons. Some people want to bleach, so they want to be fair, then they take the steroids. Some too want to get big butts. So they have various formulations. Yodi, there's a cotton. They come in and they want to get big butts. Yes.
And they buy these steroid.
Then some don't even buy it at the pharmacies. They buy it.
Yeah, I mean, I've been seeing. I see some people hawking it,
and you see a picture of a woman with a big butt. Then it's very enticing. The ladies will be enthused, and then they want to buy it. But you don't know that the steroids that are in there are also very dangerous. It can cause you to also develop ulcers.
Okay. So I think that's something that people need to be mindful of, because someone may be listening and saying that, oh, me, I eat on the regular. I don't think I don't drink and I don't smoke, but probably it's the steroid that they are taking, or probably even applying to their skin to have a big backside, and that may predispose them to an ulcer.
Exactly.
But how does someone know that there's a steroid in their product that they're using?
Because you might not know until you've spoken to a professional. So if you speak to a doctor, a pharmacist, they take the active ingredient in the product. It is always stated.
It's always stated.
It's always stated. So there could be dexamethasone, there could be betamethasone, clobetasol, like different types of steroids.
Okay. So these are the things that most of the young ladies, and to my surprise, some young men want to take to either lighten their skin or, gain a big backside, to do something else. So these things can also predispose you to an ulcer.
Yes, it can predispose you to an ulcer.
It's really, really interesting that some of the practices and some of the day-to-day habits that we get ourselves involved in can open us up to medical complications that we really, really, really don't want. And an ulcer is one of them. If you're just tuning in, we're 15 minutes past 8 o'clock here on 107.9 FM on the Orange Health Lounge. Good morning to you, Priscilla Asiedu. You're watching us on YouTube. You're saying that thank you for sharing the knowledge. But let me tell you about something else that we're doing here on Orange 107.9 FM. We're having a health walk and a blood donation. And it's time for us to walk and give the gift of life at the same time. So on Saturday 20th, which is about 2 weeks away, Orange FM invites you to join our blood donation drive and our health walk with MC Larry at the Kumasi City Mall from 7 to 5 p.m. I'll definitely be here for that walk. So I'm going to miss my show on the 20th. I'll probably do it a bit late. We're bringing to a full day of wellness and community spirit. So they'll be walking for fitness, vibing to great music from our DJs here at Orange FM. We'll be winning giveaways, enjoying some refreshments, and taking advantage of the free health screenings. More importantly, the activity we'll be doing of the blood donation will be saving lots of lives. The walk kicks off exactly at 7 a.m., led by Orange FM's drive time host, MC Laurie. So if you're listening to me, mark it on your calendar, 20th September. Bring a friend, bring energy, and let's make a difference together. If you want to make any inquiries on this, you can call 059-5702-446. This blood donation and health walk is powered by the Kumasi City Mall and sponsored by Saks Healthcare Services, CBS Supreme Industries, and Oson's Chemist. So on the 20th, I'll be in my sporty wear, and I'll definitely see you there. And here at the Kumasi City Mall, we have the fastest, cleanest, and most convenient laundry service here in town. We call it the Spain City Laundromat, and it's the first of its kind in Kumasi. You hear of laundries, but nothing like Spain City. At Spain City, they can wash, dry, and fold your clothes in under 2 hours. They serve homes, hotels, restaurants, and so many more. They have brand new machines, and their prices are so affordable, and your clothes will come out sparkling clean, soft, and neatly folded in their Spain City bags. They have the best detergents, and the way your clothes smell after taking them to Spain City, they feel like brand new. You know, the weather is cold, and if you have duvets, blankets, or curtains that you want washed, Spain City has got heavy-duty machines that can handle that heavy load. At Spain City, they don't mix your clothes. It's one customer, one machine every single time. They're open from 8 a.m. to 8 p.m. every day, and you can find them in Accra and Kumasi. In Accra, you can find them at Ashaliboche, Lakeside. In Danceman, you can find them at Akoko Photo. At UPSA, they're in the Prestige building. At Teshi, they're at Tebibiano. And then in Kaneshi, they're behind the Kaneshi police station. Here at the Kumasi City Mall, they're just next to ShopRite on the main entrance. You can call them on 055-445-5314. 055-445-5314. Spain City Laundromat, wash, dry, and fold in less than 2 hours. Now, if you're looking for a little more in life without spending more, I get it. I'm just like you. Every CD does count, and that's why I want to share something with you that really makes a difference. You know, school is opening and everybody's looking for cash. So let me tell you about the ABSA ABAPA account, which is designed for people like us, people who work hard and deserve more for less. Now, with the ABSA ABAPA account, let me tell you what you get. A free GH Link card, access to loans of up to 50,000 Ghana cedis when you need it, like when the school term opens, high interest on savings, free SMS alerts so that you track every single peso that you spend, seamless mobile and online banking, so there's no need to join any queue anymore. And the best part is it's very simple to open. So if you're looking for more value, more peace of mind, and more control over your money, then the Absa Abapa account is specifically designed for you. Open your account today and get more. T's and C's apply. Your story matters, Absa. So let's get back to our conversation this morning on peptic ulcers or ulcers in general, and why you should be a bit more concerned, like Doc just mentioned, about even the things you apply on your skin, even the things you take in this era where everybody wants to be a certain kind of beautiful. That he has said that some of these products contain steroids, and these steroids can predispose you to getting an ulcer, and it's extremely important. It's extremely, extremely important. Good morning to you, Adjoa Bafo, and you're saying that this explains your back pains. All right. Yes, you can also join the conversation on YouTube, or you can send a WhatsApp message 0593932993. So, besides these risks and these symptoms that people have, can ulcers also run in families? Can you inherit an ulcer?
Ulcers do not run in families, but ulcers can be spread through families.
Okay.
So it doesn't run in families genetically, but it can be spread through families. So with the other component of ulcer, that is the H. pylori induced ulcer. The H. pylori is a bacteria, and this bacteria spreads through oral to oral. Okay. So meaning saliva. So let's say in a family, they are all using the same cutlery, husband and wife using the same spoon. He tears the rice for you. You also do the same. You do the reciprocal for him.
You're chopping love.
You're chopping love. As you are chopping love, you are chopping H. pylori.
You're exchanging bacteria, isn't it?
You're exchanging bacteria. So if one person has the H. pylori, the H. pylori will be in the saliva of the other. Then it will just be transmitting. Another thing, it can also be spread through kissing.
Ooh.
So this same saliva exchange. Then in families, especially in overcrowded places where they really come into contact with each other often, they are sharing the same brush. They are sharing the same bowls, like the same, basically the same everything, the same cup. And before you realize, it's just spreading through the family. But it's not genetic.
Okay.
It's just a bacteria.
It's just the bacteria.
It's just the bacteria. But another thing is that the bacteria can also be shared through the fecal-oral.
Fecal-oral route.
Oral route, meaning if one person disposes of feces at some place and it gets into food or water, so just like cholera. If you eat food that has been contaminated with this bacteria, or water that has been contaminated with the bacteria, then you will get it. And this one doesn't mean you should be rich or poor. Some people say, then the poor are the ones who are going to get it.
No, I mean, you can get it.
Anyone can get it. And another thing is that it can be dormant. Some people will have the H. pylori and it will be dormant. It will never show its face until the immune system goes down, then it shows its face.
It shows up.
It shows up. Because there's a way that the body can contain it.
Okay.
It will be lurking in the stomach. So usually this H. pylori, what it does is that when it gets into your stomach, it burrows. Just like in mining, people will mine into, so it's able to mine into your stomach.
Okay.
And to stay there. Quiet. Because the acid can also kill it. So usually, the H. pylori also has this protective thing. It produces something called the urease.
Okay.
And the urease will produce a basic medium around it.
Okay.
So it's like it's covering itself from the acid. Another thing is that it usually comes out at night when you are sleeping and there's no acid content. Then it also come out to come and show its powers. So it's a very smart bacteria actually. So that's what makes it very difficult to treat. Okay. So do you know one thing about the treatment that helps? The reason why we add the PPI. So when we add the PPI to the therapy, the PPIs it stands for proton pump inhibitors. What they do is that they prevent excessive release of acid. Okay. So when you add PPI, what it does is that it creates a scenario as if you are sleeping. Okay. So at that point, you are not producing excess acid. Each pylori think that I can come out to the environment and come and play. Then as soon as it's coming out, then the antibiotic that has been added to the PPI will also come and meet it face to face. Okay. So that's the rationale. They didn't explain it like this during pharmacology. And right now we have different types of PPIs. Yes, different new generations are coming out. Initially we had omeprazole, then rabiprazole came. Now we have pantoprazole. Pantoprazole is also one of the latest PPIs, and it's really working well. It's really working properly. And you know one thing I like about the pantoprazole, usually at the hospital space, in a situation where sometimes you have patients who are put on certain medication that interact. It has less interaction. Okay. So there are times you will see a patient who has a stroke, has been put on some clopidogrel. And there's always an interaction between the omeprazole, rabiprazole, and then the clopidogrel. But the pantoprazole doesn't have that. The PPI is that one, it runs through. It should be part of the triple therapy. Because if you don't add it and you only give the antibiotics, it won't help.
Well, before we come there, you know, are there some home remedies that people say that they want to try? I know we're not at remedies, but it's because somebody's asking the question. That's why I'm asking it. That for him, this abdominal discomfort that he gets, he has been advised to drink milk, to take fresh yogurt. Are these things helpful at all?
Fresh yogurt and milk. Usually for fresh yogurt, you know, fresh yogurt contains what we call the lactobacillus. Okay. So they are called probiotics. Okay. So these probiotics help to contain the natural immunity. So it helps with the immunity of the stomach. So it helps to protect you from the bad bacteria, because when you have a lot of the good bacteria in there, it tries to control the bad bacteria. Okay. But it doesn't salvage the situation. It doesn't help with long-term treatment. It can just help you. Let's say you want to prevent it, or maybe you have just been treated of the ulcer and then you just want to maintain your stomach lining with a natural immunity. That will help. But for milk, I don't know what milk can do to help with your ulcer. But there are some natural remedies that have been shown to also protect the stomach lining. Okay. One is okra. Okay. Okra helps with the mucus production. Okay. Yes. So when you take in okra, the mucus production. Yes. So but it doesn't treat. It just helps to protect.
Okay. So it just helps to protect.
It just helps to protect.
Okay. I'm going to read this message saying that good morning to Doc and your guests, saying that the foods that were mentioned, saying that these are mainly citrus-based fruits, but usually when people are trying to fast or trying to lose weight, they are advised to eat some of these foods that have been mentioned. Saying, are there any other alternatives? Because I think that when I eat pineapples, what I fear is an ulcer gets worse. It's very commonplace when people go for consultation to probably maintain or lose weight, and they say, oh, you can start eating fruits and vegetables, and then they eat some of these very acidic fruits, and then it goes off to worsen their probably already present ulcers. Any advice for such people?
Yes, so for such people, if you are someone who already has a predisposition towards ulcer, let's say you've had it before or you currently have it, I advise that we do alternatives. We don't stick to the citrus, let's say lime or lemon containing products to help with weight loss. We have other alternatives you can do. Right now, recently, we have something called low carb diet. So you speak to your dietitian. He can give you alternatives. Low carb diet. Then he'll give you what you should take, what you shouldn't take. And personally, I've seen people who have taken low carb diet and have been able to lose weight. There's also keto diet that people also take. So you should just speak to your dietitian and have a diet plan. Then you stick to it. So and let your dietitian know that you have an ulcer, because if he's going to add in some acid containing fruits, it won't help. It won't help at all.
Okay. Adjo Abafo comes back to ask that can peptic ulcers cause anemia?
Peptic ulcers causing anemia, that means that it's what we call the active bleeding
type.
Active bleeding type. So some people have peptic ulcer that leads to bleeding. And one thing that you will notice, if you have ulcer and you haven't taken any medication, like you're not taking any iron supplement, which can also make your stools appear dark, and you notice that your stools are becoming dark, kindly report to the hospital, because it's an emergency. It means that you are having a bleeding peptic ulcer.
Wow.
And the reason why it appears black, you see, when you produce blood in your stomach, the blood also contains amino acids, and it can be digested. So the blood is digested, and at the end of the day, the color even changes. So at the point where it appears in your stool, it appears dark. It discolorizes your stool, and it makes your stool appear dark. So the fact that you're not seeing blood doesn't mean you're not bleeding. And we call it, in medical terms, we say melena stools. So once you see black tarry stools, kindly report to the hospital, because it means that you're having bleeding also. If you're not careful, you will get anemia. And this anemia can cause a lot of issues, complications. It can tip you into shock. It can cause you to even develop a kidney disease, AKI. So it can cause you to even develop some brain issues.
So I mean,
heart issues.
If you have an ulcer and it's of the bleeding variant, there's a very high probability that it can lead to more devastating complications.
It can lead to more devastating complications.
If you're just tuning in, this is 107.9 Orange FM. My name is Dr. Jima, and we're talking this morning to Dr. John EMMANUEL OPPONG MENSAH. He's a pharmacist who's a resident at the Internal Medicine Department at Confanoche, and an aspiring General Secretary of the Pharmaceutical Society of Ghana. But we'll talk about that a bit later on in the show. I mean, for the pharmacists who are listening, wouldn't you want this guy to be your General Secretary? I'm doing campaign. But
so that's
for GOSPA. Yes, that's the Government
and Hospital Pharmacists
Association. Yes, that's GOSPA. You see, he works in the government hospital, and he's eloquent. So why don't you select him as your General Secretary? Anyway, we'll talk about that a bit later. But for a lot of people who are doing the listening this morning, I think from the messages that we're getting, we're getting a lot of feedback that a lot of things are being cleared up when it comes to conversations about ulcers. And it's very commonplace for people to look for solutions outside medication.
Yes.
Everybody wants an alternative solution outside medication.
Yes.
Is it difficult to treat ulcers?
Ulcers are difficult to treat. Yes. That one is true. Ulcers are difficult to treat. But when you stick to the regimen, I've seen people whose ulcers have gone. You see, most people think ulcers do not go.
Do not go, yes. That's the general message I'm getting from a lot of people, that it's like ulcers do not go.
Ulcers do go. So the issue is that, let's say you have the H. pylori ulcer. The H. pylori can go.
Okay.
So we can give you, the drugs can take care of your H. pylori. Your H. pylori has been eradicated. But what about the ulcer healing? That was also another question.
Okay.
So if we constantly still don't change our lifestyle, the ulcers may not heal as fast as we want it to heal. Because it's just like you having an injury on your hands and you keep on using your hands for the same activities. I remember one time when I was in JSS, I went to play football. Then I twisted my last toe. Then the toe was healing. Then as it's healing, then I'll go and hit it maybe on a door. Then it will the pain will
The pain will still be there.
Then it will now prolong the injury time. Then it's healing. Then I'll go and hit it against maybe a bucket. Then it will also prolong the injury time. So it's like that. The H. pylori can be cleared. You might be not taking. You might be devoid of. You might not be taking your NSAIDs anymore. Now you are not taking the thing that causes the ulcer. But what about your lifestyle? Now the lifestyle is what will show whether your ulcer is going to heal or not. So the injury is already there. It needs to heal.
107.9.
Just like every injury takes time to heal. Ulcer injuries to take some time to heal.
To heal. Okay.
So let's say you've been treated, but you are still fasting. How will your ulcer heal when you are starving yourself actually?
Okay.
And another thing is you are smoking. How will your ulcer heal when you are still smoking? It will not heal. Though your H. pylori could be eradicated, you are still taking alcohol. It will not heal. So that's why most people have this thing that their ulcers are not healing. But once you stick to the treatment, so usually for the treatment for the ulcers, after the antibiotic course for 2 weeks, then the PPIs will be continued for another 2 weeks up to like even 1 month, just to still control the hyperacidity so that the ulcers will be given some time to heal.
Okay.
So it's just the same rationale. If you also doing things that will cause you to produce more acid, the ulcers will take a longer time to heal.
So if you're doing the things that causes you to produce more acid, someone says that they dream about food. I don't know about that. I don't know about that. So someone says that I dream about food, and can it make my ulcer worse? I don't know. I don't know if you know, but I don't know.
For this one, no, I don't even know, because
I don't know.
I know how dreams are connected to stimulating your brain to cause you to produce acid. I don't know about this.
I'm sure the person wants to pull my legs, but I don't know. Someone has sent a voice note. Let me play it, and then we'll get back to the conversation in a moment.
In my situation, I could get a very severe heartburn around my chest region, and it pushes up to my neck region, as if I want to vomit, but I don't. I want to vomit, but I don't. But and when it happens this way, my BP just rises up abnormally. Anytime that I'll go to the hospital, they will be complaining of why my BP is too up. And I don't drink, I don't do anything, I don't do all sort of things that they think I should have gotten that BP.
05936329993 05939329933 That's the WhatsApp line. You can also send your voice note like this listener has just sent. So, I mean, that's his concern. Any things to share with him?
Yes. So from the symptoms he's explaining, these are classical signs of GERD. When you have this reflux. So the acidity gets into your chest region, it gets into your throat, you feel like vomiting. The back pain he's explaining and all that. Yes, and you know one thing about GERD can also cause your chest to be tight. So because of the inflammation that is happening in your esophagus, it causes this referred pain that looks like heart pain. So it's like it can cause this pain and you might think you might be getting a heart attack.
Okay.
And this alone causes you to be anxious.
Of course.
It will increase your anxiety, like it will make your BP go up.
Okay.
So it causes your body to release certain hormones, and that hormones will cause your BP to go up. So someone might not have hypertension, but as soon as he gets these symptoms, the BPs go up.
Okay.
Anytime these symptoms happens, then the BPs are going up. As soon as he's able to get something to palliate the symptoms, then the BP now comes normal.
Down.
So it can be quite an interesting twist. And I'll say that he should go to the hospital. Yes, and then he should be diagnosed for it, and he should be put on the right medications for the GERD, because for GERD the treatment is quite different from the ulcer.
From the ulcer.
Okay. So because sometimes you can also have GERD and ulcer at the same time. So once he has the GERD and then ulcer at the same time, the symptoms become even much worse.
Okay.
Yes. So there's hope for our brother. He is not. It's not all hope is not lost.
All hope is not lost. I
Yes.
think that there are diagnostic techniques that we'll come to in a bit that can help to differentiate what you have. It's like Doc said, it's not. It may not be an ulcer like you're thinking. It may be acid reflux, and that has all the classical symptoms that you showed. So. It's not enough for those who are seeing you to say, hey, why is your BP high? Why is your BP high? There may be a mixed bag of things going on at the same time, which is causing you to have these. And like Doc said, it might possibly be gastroesophageal reflux disease, which is causing this, whose treatment is very different from an ulcer. But Doc, let me also ask, the way ulcers are advertised to be treated also gives some cause to worry, because everybody is selling like a silver bullet for ulcer care, like, if you take this medication your ulcer will go forever, and people are hooked onto these medications.
The herbals?
Not even herbal, sometimes even the what we call the orthodox or the allopathic, like, people say, wait there, if it should go. The challenge that most people are having is that because we have not differentiated whether it's gastric or duodenal or GERD or NSAID induced, we're taking anything for everything.
Yes.
We're taking anything for everything. So someone may be having GERD and has been put on triple therapy.
Yeah.
So his question is that, how do we sort this out? Should we be specific on what the patient has and say, you know what you have is gastric, what you have is duodenal? What is that where we should be going towards?
Yes, that's where I'm advocating that we should be going towards, and especially as medical professionals, we should be able to really probe very well to get the actual diagnosis, because sometimes they look similar. Yes, they look very, very, very similar. And imagine that you are treating GERD for ulcer, or you are treating ulcer for GERD. So for GERD, the PPIs, you do higher doses. Unlike ulcer where you do lower doses.
Yeah.
And for GERD, usually we do once daily dosing. If it's very severe, then you can do twice daily dosing. So there are different management styles. Yes. And even the type of antacid that will be given will be different for GERD and for ulcer. Because for GERD, you are looking out up to giving an antacid that contains something that can form a raft to prevent the acid from leaving the doors of the stomach into your esophagus. So that's also another thing that is a challenge. And then it also contributes to the reason why some people's ulcers are not going. Possibly they are not taking the right medications. Some are also not taking the right doses.
Okay.
Some are also not taking it for the right duration. Yes, and some too are listening to family and friends. Oh, I took this, it worked for me. Then you two go and buy, and because those ones are over the counter, then you just go and buy them. Over the counter, listen, the normal one that we know, Maga said, the fast melt, the one that it will just, you put it in water, and to just dissolve, and then you just drink. And we just be taking it. Number 10. There are different types.
There are different types. Like one of the okay, so let me read this question quickly. So he's saying that one of the things that she heard growing up was that it is the spiciness of food that triggers the ulcer, because the more spicy the food, the more likely that that particular food will go and burn your stomach, in quotes. So saying that, can we educate the public that very spicy food is not the cause of an ulcer?
Yes. So as I've earlier said, spicy foods, what their contribution is that for spicy foods, they cause hyperacidity. So it causes your the cells that releases the acid to release more acid. Yes. So that's one thing about spicy foods. And the question is, some people are able to tolerate it, others may not. So some people, once the acids are released in excess amounts, their mucosa, their stomach lining is able to tolerate it. Otherwise, others will also have issues. There are people, as soon as they take in spicy foods, then they will have the burning. They can feel their stomach is burning.
Yeah.
That means that for you, you shouldn't be taking so much spicy foods. Yes, because your stomach lining is able to tolerate that amount of acid that is being released from your stomach to handle the spicy foods.
Okay.
Yeah, so everybody is different. So it comes back to the point that we should know ourselves. We should know our body and how our body reacts to every food. How our body reacts to every food is very, very important. Some people also take in milk, certain seeds, nuts, and then they have hyperacidity, which leads to bloating. So everybody is different.
So you may think that you are taking these seeds and nuts for health.
For health.
But it may just be the one that's causing your hyperacidity.
Yes.
Hey.
Me, for instance, when I take in some of these seeds, the granola seeds, almond.
Oh, then you can't eat my yogurt. That
cashew.
Okay.
It does that.
Okay.
But when I add it with yogurt, it goes down.
Oh, then I sell yogurt. I'll bring you.
So if you have yogurt and then you have the granola mixed it, that's a perfect recipe.
So you come and buy some.
So I'll come and buy some.
Anyway, if you're just tuning in, this is 107.9 Orange FM. And this morning we're talking about peptic ulcers and everything that ails you in your tummy that you misdiagnose and call as an ulcer. Good morning to my friend pharmacists who are listening. And, we're at the point where we need to push public education properly. Because if we don't educate the public properly, a lot of these conditions that we talk about are always going to be on the increase, and that's why we're doing this. And that's why we say we do this only with the experts and those who know what they're talking about. Because like he just mentioned, sometimes you may want to take on a new food role. You want to say, oh, I now eat seeds, and I now eat these almond seeds and these chia seeds and blah, blah, blah. And for that's what is causing your challenge. So you should be mindful of what even the effects of the supposed healthy behavior is doing to you. So it's good information, no? Good morning to you, David Dakwa. You're a laboratory scientist at the Asnomaso Government Hospital. You're saying you're doing the listening. He actually sends me a picture of him doing the listening in his radio, in his car. Good morning to you, Dave. Good morning to the other Dave, MC Portfolio. This show is free consultation for you, so I expect my momo at the end of the show. And to all those who are doing the listening, we really appreciate this. Let me announce the phone lines now, so you can share in the conversation whilst we continue. You can call us on 0541 022 318 0541 022 318. Doc, before we go on, I don't know if there's a Chi expression for ulcer, but let me play this voice note. So, what else you think about that?
Mostly sit a lot. I walk a lot. Good morning, Orange FM. Please, as for me, I also want to know, I'm a fashion designer because I mostly sit a lot. I walk a lot. So sometimes I might feel, sometimes I'm feeling a back pain. After feeling the back pain, maybe I took something, maybe penicillin tablet or so like that. Then later, before 24 hours, I feel some relief behind my waist. Could it be a symptom of ulcer or just the normal waist pain? Please, I just want to know.
All right, thank you very much for your comments. I really appreciate your comments. So that's his question. His name is Gentle, isn't it? From UGC. Yes.
So he took penicillin tablet and then he had some pain at the waist and then it resolved it.
Yes.
So this I'll say that he should go and be diagnosed properly because once you take antibiotics and you get some relief, this could be H. pylori. H. pylori induced peptic ulcer. Yes. And you should get diagnosed. So with the diagnostic, they can take a blood sample or stool sample, check to see for the H. pylori. And with the blood, they will check to see for the H. pylori antibody. Yes. And there was one time some patients who were treated with the H. pylori triple therapy. So they went to do their labs afterwards because definitely you want to see if it has gone. It has been fully eradicated.
Yeah.
So we realized that this person did the blood. We are still seeing the H. pylori positive. Like, is that the thing that didn't work? No. So after 2 weeks, repeat. Still positive. But the symptoms are gone. He doesn't have the symptoms.
Okay.
But the thing is that for H. pylori, even if it is eradicated, the antibodies that are produced in the blood, it takes up to like 1 month for it to be cleared.
For it to be cleared from your blood.
Yes.
Okay.
So it will still be there. So precautionally we advise that the stool culture is more confirmatory.
Yeah, that's true.
If we do the stool check, antigen check, that one can confirm it.
Yeah.
So once it's negative, that one, as soon as it's cleared, it will show.
It will show that it's gone.
It will show that it's gone.
Okay. So to my friend who sent the message, and given your profession, you also sit for prolonged periods, which means that you should check the chair you are sitting on to work. Ergonomics is something that we ignore.
Yeah.
So you will have to. I don't say may. You will have to check the status of the chair that you're using. Okay. So let me pick this call, and yes. Hello. Good morning.
Good morning, Dr. Jima.
Hi, Obapa. Good morning.
Good morning. How are you?
I'm fine. I hope you're well. Me dance Obapa.
Me akase janko punchida me pa no nyamo kese. Na me pa cho. De mpese me busa ne se ubehu obi. Wose de ebusu nyina ye wo ulcer. Me pese me busa doctor se eye no kore. Na me pese me busa se obomu so obi wo ho a odidi a no ofe. Tembia odidi a no ofe. No so se ulcer. Dodo na nko hospital so dodo na so se wo mo ulcer. Nti da mpese me busa doctor se eye no kore. E na me so no me problem am mpese me busa doctor. Edu se me bu mensa be etu da moja ne ba bebre a na makoto briefing. Na ma we na ma no nsu na moja na susu. Nti da mpese me busa doctor se ma ho so wo ka bibisa na mpese me busa se eye. E no so beti ba ma wonya osa na se de yi. Yamishram.
Yo, Yamisha, bye, Yamisha. Yep. So that's a question. Now also you hear it quite a lot.
Yes. So as I said, so also the your friend Yem Crow. The Yem Crow the any busiemu bia the untimi nka say we busiemu mo munyamo also, but the bit my actually say ebusiemu so the ebo genetic component be run it through. Such as let's say more food allergy be. And I say hyperacidity. Some find induane bi amunya timinya hyperacidity. Enu timi wo ho. Say like say busuan we mu de ye di jena na ye produce a lot of acid. Ntini nia etimi cause ntina make us no nia aggravating factors. Nyema etimi emma wonya ulcer, but ene no na cause ulcer no per se. Ana obi so a oka say ofe bebre a ulcer. Ntimi nka say the fact say ofe bebre and you also because and you might be bit mama off it. You might be bit me cause FNT. I was you to me, Emma, and I see it, and it me call hospitals. No, hospital in Beko.
Okay, let me pick this call, and then we'll also come to her issue about taking a lot of the briefing. Hello, good morning.
Good morning, Mr. Jima.
Yes, how are you?
I'm fine, thank you.
Yes, I'm good. Kindly go ahead, please.
Okay, I would like to ask, I'm allergic to contumely. Anytime I eat it, I feel itches all over my head, my nose, my ears, every part of my head. So I wanted to know the causes of that because I don't know. So sometimes I used to mix it with cabbage. I would just get some small contumely and then add it with cabbage. But still, I just feel the itches. I want to know the causes.
All right. Thank you very much for the call. I didn't ask your name. What's your name, please?
Phyllis.
Okay, Phyllis. Thank you very much for your call. 0541-022-318, 0541-022-318. So then let's go to Obapa's second question.
So Obapa question. Obapa macho briefing now no. What guys say boja ni ba
Was it? Also,
already briefing, no. But your briefing and real. Briefing and I was saying, because briefing crying as I want to say, NCs no, echo yum crack again, no cry, no effect. I caught irritation.
Okay.
To GI line, no. As an answer to be round mojemu. A round mojemu, so I was answer effect that a baby do you see mucosa, no. Line na protect no be reduce nti o time nom dia na enye say o yemi oya let's say wo anase wonya eni edane sasa na omka no wo twimi eni edane dysmenorrhea
but I didn't see any ya
nti say enye oya dia memfa
o say any ya e ba bebre but onum proof ni pena eso susu na ya on the call
say obano for just some short days be there is okay. Because amounts NSAIDs nankasa your it be at me a more risk of causing ulcer. It be a paroxysm, ketorolac, and no the risk of NSAIDs they are very very strong. But briefing they very mild.
Okay.
Briefing your mouth. And it say obanom briefing na the American say onom no after meals and I'm on risk.
Okay.
So often after meals I reduce GI direct GI irritation say ebeka oyem no say if na nka binya no e wo oyem line no so no e reduce no nti onye ne samai ana brufen so ne mefenamic acid no as me kan no eno so timi reduce bleeding nti na ofire no bleeding no so eso tie no.
Okay, Obapa is calling back. I'm sure for clarification, so let me pick her. Obapa.
Dr. Jima.
Pacho.
Ya na me yo moja no flow no do so a nti the more na me reserve roofing no mo so ku so na eja nti say doctor to me for nya say da na me review so me was moja no flow no baby prayer me dia ko hospital sa my break nti me jai ko nti ma won say me reserve roofing na be jaya na ma re nti doctor to me for be jai. Also 24.
Wejai. Ebi ade meka sauce ne say doctors things you different types. Ebi who be here so back who gynecologist. Na wabwa was our quine so. Yes, answer ebi next week and answer next 2 weeks me the gynecologist beba. Mo about be churches answering ebano you know menstruation home common ni menstruation home in sense ma ana oba Paudrin Hussein
me pacho matepa now hospital na ko bebre of anoche na ko bebre doctor no person what tell me say me my CS5 nti no so what say no so betimi akọ fa so ati ase no be me jai ko no so ka that's it nti mo di omo am be chire bibisa ba be ne beji pa me sua de bebre wo na me shiram
oba pamedasi this I have to give Obapa an award. Yeah, she's my most active listener. I have a lot of people to give awards to, but I can't award. No. 0541 022 318. That's the number to call. And then Phyllis said she reacts to contumely.
Yeah, so contumely's reaction is actually real.
Okay.
Some people react to contumely when it's not well cooked, or let's say thoroughly
cooked.
Yes. Even me myself, I have that reaction. When I eat contumely that is not cooked for a long time, I have itchy throat.
Oh, sir.
Yes. But if it's well cooked, like it's thoroughly cooked, I don't have that. But my wife doesn't also have that. Whether it's so
so it's more likely a food allergy.
It's a food allergy.
Okay.
Yes.
So Phyllis, what you have is a food allergy.
It's a food allergy, and
but she says when she mixes it with
cabbage, it reduces.
Maybe that's the way you have.
So that's the way she has to do it.
Okay. Hello. Good morning.
Yes, Dr. Jima. Good morning.
Hi. Good morning. Good morning.
Yes, my name is Henry.
Yes, Henry. Kindly go ahead.
Yes, I was once diagnosed of ulcer. It's been a while now. I think I was given something so which helped the situation. And I think for some time now, I've been experiencing some abdominal pains. And I don't know whether it's coming back or not. I don't know. But your doctor also said intake of alcohol can also ignite it. I hope that is that's what.
Yes, that's true.
Yes. So in that case, you have to avoid it completely, or you can take it, but it should be in moderation.
As for this question, Harry, I'll answer it. 0541 022 318. Doc Unsempa. Yes. Say that he went to hospital. He was giving like one of the PPIs, and then he's also asking about the correlation to alcohol. So you keep that. Let me pick this call.
Hello. Mr. Jima.
Hi. Good morning.
Yeah, this is Queen Lizzo. The contumely issue. I often I cook it very well. Even sometimes 45 minutes, getting to 1 hour. And when I put it in the stew too, I make sure that it's cooked very well. But still, so it's not that I don't cook it well. I cook it very, very well. And it takes long time on fire. It worries me a lot. Yeah. So, and more, when I go to hospital, they ask me to eat more vegetables. I had a ovarian issue problem. So after that surgery, they advised me so many times. But whenever I take that, I don't feel comfortable with it. Sometimes I'll even get sick when I continue. Yesterday, somebody wanted me to do some for him. Just tasting. I tasted something. I was feeling this itch in my mouth and my gum as well.
Oh, okay.
So there is, if there is anything that I will do so that I will not have this effect on it, you should kindly tell the doctor to help me out.
Okay.
Because I love consumer a lot, but I can't eat it because of this problem.
All right. Thank you very much, Queen Lizzie. I also love consumer, but thank you, I don't have this problem. But I think that in all fairness, sometimes when you have a food allergy, the best option is to avoid the food.
It's to avoid the food.
Is avoid the food. I know that there are variants to contumely. There are things that are similar to contumely. So maybe you may have to try that. But sometimes when it comes to food allergy, the best is to avoid. Hello, good morning.
So good morning, Doc.
Yes, please. Kindly go ahead.
Please, I want to ask this question. When I teach, so when I wake up in the morning, there are times I don't eat. So from 7:30 to 9:30, what I realize is that my stomach becomes a little bit big. So I keep wondering whether it's because I've not eaten and I've spoken for 2 hours. So because of the air, that's the reason why my stomach has bloated. But what I also realized after that is that I pass out a lot of gas after 2 hours of talking, the bloating. So I don't know. And then somewhere this year, I went and then I wasn't feeling anything. I went to the hospital just for this malaria, and then they did a test and it came and they said I don't know whether they said ulcer or not, but I was given that kind of medication that you take it 30 minutes later before you eat. Yes, that was the medication. And then I think he gave me anti-seed also. So I don't know whether I'm a potential patient for ulcer or I already have it. But as for the eating, if I don't eat in the morning and I speak from 7:30 to the 9:30, I have this gluten and then it makes me pass a lot of gas. So I don't know. Can you please? I want to find out what it is.
All right. Thank you very much for the call.
You're welcome.
All right. 0541 022318. I want us to finish our friend's call, Henry's call about the alcohol. He wants to know how much of alcohol is a problem for somebody with an ulcer.
Yes. So usually the WHO recommendation will say 2 units for men, 1 unit for women. And based on the calculation, you look at the alcohol percentage that is in every product, then you do your calculation. So he has to actually stick to that. If he's having problem with the calculation, he can let a friend pharmacist do the calculation for him. Once he knows the percentage of alcohol in it, then you'll be able to do the calculation with the 2 units. And exactly, you will know how many mLs will be equivalent to 2 units. Okay. So that he sticks to that. And because of the ulcer.
Just a minute. I don't know what's happened to the call. I don't know. Okay, sorry, whoever was calling, kindly go ahead.
And because of the ulcer, I am advised that even the 2 units, he reduces it to, let's say, 1 unit. And to not cause any problem. If it's 1 unit for him, it's fine.
And then sometimes you also have to understand that what you are drinking is killing you or is making your condition worse. You have to stop. I know stopping alcohol is not easy for someone who has made it part of their habit, but you have to get into the understanding that you have to stop because you may say you want to take just 1 shot, but the shot you are taking is 45% alcohol, and that will further go and worsen your ulcer. Alcohol is something that you learn to start and then you also learn to stop. So I think that's the best way to go. Then a lady who called and said she doesn't eat for about 2 hours, and then post that she's bloated. Okay, I think. All right. I don't know who is trying to call, but I think there's a challenge with the phone lines. Sorry, you can call us back on 0541 022 318.
Yes. So for her issue,
okay. Yeah. Let me pick the call. Okay, it's better now. Hello. Good morning.
Good morning, doctor.
Yes.
Please, I want to switch from the topic and bring in my problem. In fact, I'm suffering from nasal bleeding. And it has taken about 21 years. Just that sometimes it will stop for maybe 8 years, and then I realized it has started again. So from last April, it started, but then it has stopped for about 7 years. But from April coming down this time, it is not stopped. Sometimes, maybe in a week, it will come for about 3 times. I visited ENT several years ago, and last time when it started, I went to Children's Hospital. So I don't know. Though I'm on blood pressure drugs, like Sinopre and amlodipine. So I don't know what is causing this.
Okay, so I have taken note of your number. Okay, I will call you after the show. All right.
Thank you.
All right. 0541-022-318. Yes, please go ahead.
Yes. So with our lady's question.
Hello. Good morning.
Hello. Good morning. Good work you're doing.
Thank you.
I want you to expatiate on the HP full definition, full meaning of H.
The H. pylori.
Yeah, H. Yeah.
It's Helicobacter pylori.
Oh, okay.
And like Doc said, it's a bacteria. So,
yeah.
yes. All right.
All right.
Thank you. Yes, so on the lady's question.
Yes. So the reason why she experiences that bloatedness in the mornings, you see, usually in the morning, the body produces high cortisol. So cortisol is produced by everybody in the morning to get you ready for the day. Okay. It's also known as the stress hormone. It helps you to be able to handle the day's stress so that you don't break down. So you realize that every morning you are very active. Your brain is super active. Your blood is flowing well. And it's all because of the cortisol you are producing. This same cortisol can also aggravate your risk to getting what? The bloatedness or hyperacidity or reducing your stomach protective lining. So we advise that you take breakfast. Breakfast is very important. In a case where you can't even take breakfast, drink water, a lot of water in the morning. It helps to reduce the stomach acidity. Okay. So when you're taking a lot of water in the morning, at least it helps reduce the stomach acidity and prepares your stomach for the day.
Okay.
Yes. So with that, it will help reduce the symptoms she's having. And the symptoms she's having because she's producing a lot of acid.
Lot of acid.
And the body is reacting with the acid and it's turning to the gas she's having, and it's causing the bloatedness. Okay. And she's passing out a lot of gas.
Yes. Because the body needs to find a way to let the gas.
Yes. So either you belch it or you pass it as flatulence.
Okay. So then it's important that you also try and make time to just eat a small meal, probably on the go, like something small on the go, which I think would be helpful.
Yes. I don't know for her schedule, if she gets some even buffalo is fine. Something quick.
Something quick to eat and then move on.
Yeah.
It's probably the best way to go. But the bloating is as a result of overproduction of acid. Of acid. And we've been saying H. pylori, that is Helicobacter pylori. For those who want to, probably go and Google it and look at it, How does someone get a definite diagnosis that they have this kind of ulcer or that kind of ulcer? Whilst you hold on with that, let me play this voice note that just came in shortly.
Okay, please, I want to chip in this. My wife also have excessive bleeding whenever she's menstruating. And two, anytime that we will have sex, she will get severe bruises at a vagina, and I want to know why. Probably maybe it might consult to any infection of that sort, but I just want your explanation, please. Can we get any medication? Can you describe any medication for us to take?
All right. So I have your details. I will definitely get back to you after the show. So how does one get a definite diagnosis for ulcer?
Yes. So for ulcer, history is very important. So you have to get to know the history of presenting complaint, how long you've had the symptoms. That will help us to differentiate between even the gastric ulcer or the duodenal ulcer. As I said when I was starting the presentation, that if you eat and then you have the pain, that means that it's pointing out to gastric. If you also have eaten and the pain reduces, then it is pointing out to what the duodenal ulcer. So the duodenal ulcer, you're having the pain when you're hungry. But as soon as you eat, then the pain palliates. So those are the differences. So history plays a very pivotal role in the diagnosis. And another thing is the history also helps us find out whether you are also someone who abuses NSAIDs. How regular you take NSAIDs, and to help us know that, okay, this is pointing out to NSAID-induced ulcer. Then there's a more confirmatory diagnosis that is called endoscopy. So with the endoscopy, an endoscope is passed through. So it's like a tool or a device that helps the viewing of your stomach. So a device is passed through your mouth to your stomach, and it will help to view what is happening inside your stomach. So if there is an ulcer, it will see it. That, okay, this is the ulcer. And in case there's even GERD, it can also give us some picture of the GERD. Okay, is your LOS weakened? Are you having any issue? Because some people have GERD as a result of a condition called a hiatus hernia. And the hiatus hernia can also be seen when there's endoscopy. Yes, so it can also let us know what is actually happening. And during the endoscopy, they can also take a sample to check for culture, and then the H. pylori can be cultured and say, okay, your ulcer is from H. pylori. Then there's also the blood test, and there's stool test that is also done. So the diagnosis plays a very key role, and we shouldn't just out of the kilter that we say we have ulcer. No, you can't just say just like that out of the blue that you have ulcer. You have to be diagnosed, yes, properly, that you have ulcer.
Okay, so it is the appropriateness of the diagnostic modality.
A diagnostic modality.
Okay, but people don't like endoscopies.
And you know another thing about endoscopy? There are people who have ulcers for a long time and they didn't know, and they didn't know that what they have
is an ulcer.
It's an ulcer. And accidentally, during endoscopy, you find out, no, this is not an ulcer. It's actually a gastric CA.
It's a cancer.
It's a cancer. So ulcer can lead to cancer.
Okay.
Yes. That's part of the complication. So the injury in there, if care is not taken because of the body's mechanism, and if you have these predisposing factors to cancer, your body is trying to heal it, then it's going back, healing, and before you realize, it will turn to a cancer. It can become cancerous. So there are people who have developed cancers, and they thought it was ulcer. They were taking ulcer treatment, but no, it was
a cancer.
It was a cancer.
Wow.
Then there's also another cancer called the Zollinger-Ellison syndrome that causes you to produce a lot of acid.
Acid, yeah.
Yeah, so it's like a tumor of your pancreas that makes you produce a lot of acid.
Yeah.
And when you produce the acid, you'll be thinking you have ulcer, you are treating. So that's why the diagnosis is very important, because if you are not diagnosed, you will not know. Endoscopy is not a fine thing. It's not very comfortable, but it helps.
Yeah, I know. I mean, every time I'm recommending someone to take an endoscopy, I always conscientize them that it's, I mean, even though you are put to, like, you're sedated, it can be a bit uncomfortable, but it is very helpful for us to, determine that you have an ulcer. A sample is taken. But like you said,
yes,
so endoscopy is like it's a camera, a very tiny camera. Let me say that, a very tiny camera at the end of like a wire, which goes through your mouth, through your throat, for lack of a better expression, into your esophagus. Looks around, it's like I'm having a camera look around your stomach, and they actually do a nice thing by recording it for you so you can watch it later. They look around, your stomach lining, and they go all the way down to look for the ulcers. They want to find it, and sometimes they can even do some sort of treatment when they are down there. So it's something that if you've been bothered by an ulcer for a long time, you should think about getting an endoscopy.
Yes.
Think about getting an endoscopy. And there are lots of gastroenterology experts who do this. Unfortunately, they haven't paid me for adverts, so I can't tell you which one to go to. I can't tell you which one to go to. But if you go to Konfanochi Teaching Hospital, they have a GI clinic where you could go and then have a session booked for you. So it's the GI people who are listening, come and pay me. I'll mention your But I know Konfanochi does it. They can go to Konfanochi, ask of the GI unit, and they'll do it for you. Konfanochi, they don't pay me for mentioning Konfanochi. So that's. So after you get your diagnosis, then you're put on the appropriate medication, isn't it?
Yes.
Okay. All right. Then you must. How long? So sometimes the medication is for 14 days.
Yeah, sometimes for 14 days. Then the PPI, so antibiotics for 14 days. Then the PPI will be continued. There are times where there's also H. pylori resistance.
Okay.
So the person might take the H. pylori, but it's not going to work because of antimicrobial resistance.
Yeah.
So hitherto we used to use amoxicillin and then metronidazole a lot, clarithromycin. But now there are newer generations, newer modalities that are coming up. The NICE guideline recommendations for peptic ulcer management. There's even levofloxacin having a role to play.
Okay.
There's rifabutin having a role to play. There's also furazolidine. Also has another role to play. Tetracycline is coming in.
There are options to.
So there are varying options. So let's say if you do the treatment, do a test, and you are still testing positive for H. pylori, we can change
the medication
to a different one.
Okay. I think the NICE guidelines are some of the things that most clinicians should use, because sometimes patients say, you go here, you are given 1, 2, 3. It's not working. You go somewhere else, and they're giving probably just a slight variant of what the other person gave you.
Yes.
So then that's also not working, and people keep going round and round in circles, and they're taking the same kind of medication. So sometimes as clinicians, we should go the extra mile to make sure that we're reading the guidelines are coming out, every now and then. Just take the pain to go through and recommend the best form of medication for your patient.
And then, as you said, the best form of medications, I would also like to add to that the best form of brands.
Yes, the best form of brands. That's
because
true.
You can't let your patient pay so much and then finish and it's not. Let's do the best brand. If you know you are doing amoxicillin, then you do a very good brand
of the amoxicillin.
If you are doing a good brand, so the antibiotics do good brands, the PPI do good brands for that time, get results, then the person is good to go.
That's a pharmacist's advice. Good brands, because it's good money for the pharmacist and the big pharma. Anyway, but what's one? I mean, before I let you say, give a message to your gospel members, what's one advice you would give anybody who is listening this morning who is having an issue with ulcer?
Yes. So one advice I would say is that ulcer is treatable. Yes, ulcer is treatable. Don't think that your ulcer is like a family heritage. It's something that you've come to inherit and you have it till you die. No, it is treatable. Sometimes our own lifestyle tells or determine whether it will go or not. So in as much as we are going through our treatment, let's also change our lifestyle. We should know the provocating factors, so that we stay away from all the provocating factors. Let's say you take alcohol, please, as Dr. Jima is saying, let's reduce or stop the alcohol if possible. And it will help us a lot. And also, we shouldn't think ulcer runs in families, but ulcer can spread through families.
All right. So that's something good to note. My guest is a contestant in an upcoming election for government and hospital pharmacist. He's contesting for general secretary.
Yes.
And I know there are lots of pharmacists who are watching us today.
Yes.
So I'll give 1 minute to do campaign.
Yes. So so I would say that to my fellow gospel members in the upcoming election on the 24th. Yes, of this month, during our AGM, I'll canvass for your votes. Vote me, and I'll serve you. I believe leadership is not all about showing off your powers or your prowess, but it's about service. Yes, so that's what I bring on the table. I'm also very approachable, open to ideas, open to people's problems. So that's what I'll bring to the table and make gospel a better one. Especially for the young ones, we are bleeding. we've bled for long. Yes, so kindly pull your support for me, and I would also make all of us happy. I'll make gospel a better one. Yes. So
right.
Thank you very much.
Thank you very much. There'll be good music. We'll be keeping fit. We'll be having health screenings. And we'll also be saving lives. I will definitely be there. So this blood donation, if you want to make any inquiries, you can call us on 059-5702-446. This blood donation is powered by the Command City Mall and sponsored by Saks Healthcare, CBS Supreme Industries, as well as Oson's Chemists.